We were so excited. It was slightly a surprise, but a very welcomed one. My water broke on Christmas Day. He was perfect and came out screaming just the way you want it. James completed our family for sure. Right at 3 months postpartum was Easter Sunday, and that is when I lifted William out of the car seat and tweaked my back. After I tweaked my back at Easter, I had a very acute incident where I was actually helping my first get ready for school, and I knew I was gonna sneeze. It felt like my spine was detaching from its body and electrocution running through my body, and that was definitely the moment where I knew there was something wrong. Couldn't pick him up, couldn't make dinner, couldn't get out of bed, couldn't go to the bathroom without support, couldn't shower, couldn't do anything without help. Next level, it got dark where I was wondering if I was ever gonna not be in pain again. Lucky enough, I do work at Orlando Health, so I called them. They were able to get me in that morning. In the first MRI, they found 4 compression fractures in my spine. He said that he wouldn't see compression fractures like this even if I was in a 12-car pileup.
I see lots of patients with bad fractures and a lot of pain, but they're usually much older in a different phase of life. The first thing we did was a DEXA scan. The DEXA showed that she had low bone mass for age. I was worried for her. I was thinking, she has significant osteoporosis. I was worried she was going to keep breaking. There are only a limited number of things associated with premenopausal osteoporosis, and one is pregnancy and lactation-induced osteoporosis. It's not very common. I hadn't seen it before.
In some sort of twist of fate, she was already scheduled to go to an annual conference she always goes to.
And one of the featured speakers was talking about pregnancy and lactation-associated osteoporosis and what happens to bones during pregnancies. It did confirm our thoughts that this is what was happening with Ultima.
There's obviously a lot of pain that comes with this, a lot that I couldn't do. The scariest part was not knowing what it was, or if I would get better, or what the turnaround time is, or what I could do. So that diagnosis was everything.
So normally, lactation is a healthy, wonderful part of pregnancy and raising children, and this was an exception.
I stopped breastfeeding. I started bone growth injections, and then once cleared, almost 5 months later, I was able to start physical therapy. I'm feeling much better. PT has helped tremendously, not just physically, but mentally. Like, I realized I can do some of these things that have terrified me, like picking something up off the ground or picking my son up again. I had a 15.1% increase in bone density in 6 months, and Dr. Jablonski was over the moon.
In my research, it seems like it's between 4 and 5 women in 10,000 have this happen, but there are thoughts that maybe it's underreported.
If I can help anybody going through this with a little more information, a little more of what I did, a little more of a light at the end of the tunnel that you will get better, that's why I'm doing this. My ultimate goal is to live what I would consider a normal life again, holding my boys, not having to panic. I want them to just have their mom back in full force.